In this video, I'm going to be looking at variations in responses to drugs. So, for example, people differ in their responses to drugs, and there are two ways in which we can get variations in drug responses. First of all, we can have variations between people. So these are inter-individual differences. We can also have variations within a patient. So we could call these intra-individual differences. So now let's have a look at some of the ways in which this can happen. People can differ in different ways. Let's start off with intra-individual differences. No, let's not. Let's actually do inter-individual. I think that'll be easier to start with. So now we're doing inter-individual difference. How can people differ in their response to drugs? Well, first of all, they might differ in their age. So people at different ages might respond differently to the same type of drug. They might also differ in their weight. So quite often drugs are dispensed or recommended as so many milligrams or grams per kilogram. There are also differences in gender. Males and females respond differently. Related to that is pregnancy. There are also genetic differences between us, and this of course is important for personalized medicine. Which is a very important topic today. And finally, this might seem obvious, but people also differ in their state of health. So if we look at age, first thing to notice is that drug elimination is slow in very old or very young people. So if we plot age here and the rate of elimination, you find that it's low in very young babies, it goes up, and then later in life it goes down again. So for example, in a baby, the half-life of digoxin so the T half of digoxin in a baby is 200 hours. In an adult, it's 40 hours. So adults get rid of it 5 times as quickly. And in an elderly person, it comes out to about 80 hours. So that's how it differs in age. And that's largely due to rates of metabolism and changes in glomerular filtration rate, the speed with which we filter through the kidneys. So 2 examples of this, which are really important, are 2 conditions called kernicterus and grey baby syndrome. So what happens in Kernicterus? What happens here is that normally we all have albumin in our blood, and in babies, or as indeed in all of us, we need to get rid of bilirubin, one of the breakdown products breaking down our red blood cells. The bilirubin binds to the albumin, and that's how we get rid of the bilirubin. But the problem is that when you give a drug, that can actually compete with bilirubin for this site. So that means that bilirubin doesn't get excreted. And so the result is the baby goes yellow. And so this happens, for example, if you give morphine during labour. In the case of grey baby syndrome, what happens is that neonates, so babies that are born a bit too early, if they're given chloramphenicol intravenously, they develop these very unpleasant symptoms, including abdominal distension, vomiting, and so on. And it's a very similar idea. In this case, we still got a problem with albumin, but the problem is that the drug, in this case is chloramphenicol, should normally bind to the albumin, but the problem is there's not much here. The babies just don't have much albumin. And so the result is that you don't mop up enough of the chloramphenicol, and so you effectively overdose on chloramphenicol. There are a couple of other reasons why age affects drugs, and that's first of all because of the amount of fat. Older people tend to have more fat, and so that means the volume of distribution increases. And I show you in other videos why that's important. So the volume of distribution increases because the drug is taken up by these fat bodies, and so it's as if you had a massive volume of distribution that's disappeared into the fat, so it looks as though you've got more plasma than you actually think. And what this does is that it actually increases the half-life of the drug, because when you eliminate it from the plasma, you've got all these big reserves in the fat, and so that continually supplies drug as you're getting rid of it. And then the other thing is that simply the rate of metabolism goes down as you get older, as I can testify. So those are the reasons why people different age respond differently to the different drugs. We also mentioned that another factor is weight. Why does weight affect your response to drug? Well, the answer is simply that your volume of distribution is effectively increased, partly because of fat, but because there's more of you, there's more tissue. So once again, this leads to an increase in the T-half, the half-life. So whereas in a young person, you give them a single slug of a drug, it will go down like that. In an older person, what happens is the drug initially goes up, some of it is then stored in fat, and so that acts as a sump or a reserve, and so it lasts longer. So what happens if you give top-up doses here in a young person, the effect on an older person is the top ops get much magnified. So we've now done age, weight. Another factor is gender. So there's a number of reasons why there are differences between men and women. And these are just physical differences. So women they tend to have larger percentage of body fat, so that increases volume distribution and increases the half-life of drugs. They also have lower renal clearance, and so that's because of lower glomerular filtration, so they don't clear unchanged drugs as much. And they also have lower levels of variants of P450 enzymes, such as CYP1A2, 2E1, 2A6, and so on. And you can look these up, 2A6. And so what all this means is lower metabolic clearance. So as a result of all these things, women do tend to have higher incidence of toxicity or toxic responses and increased gastrointestinal adverse effects caused by non-steroidal anti-inflammatory drugs, and also allergic reactions. So we've got age, we've got weight, and we have gender. The next on our list is the effect of pregnancy. So why does pregnancy affect responses to drugs? Of course, one reason is that there's an awful lot more of you. Your effective volume has increased, and so that means your volume of distribution has increased, etc. Another one is that the baby takes up your proteins, and so you have lower albumin, and we've already seen what that can do. They also, during pregnancy, you have an increased cardiac output, and that will therefore increase glomerular filtration rate, and that will actually increase drug clearance, so that gets a bit complicated. And the final thing is that the unborn baby itself also swallows a lot of the amniotic fluid. And that slows down elimination because the drug is being taken out of the circulation. So so that's pregnancy. Then so we've got age, weight, gender, pregnancy. The next one we want to look at is